Question 1. A client arrives at the emergency department with severe chest pain, shortness of breath, and diaphoresis. Which action should the nurse take first? A. Obtain a complete health history. B. Administer prescribed pain medication. C. Attach the client to a cardiac monitor. D. Encourage the client to rest. Correct answer, C. Attach the client to a cardiac monitor. Rationale: the client is showing signs of a possible myocardial infarction. Continuous cardiac monitoring helps identify life-threatening dysrhythmias quickly. Strategy: prioritize interventions that assess airway, breathing, and circulation, ABC. Immediate monitoring provides critical information for emergency treatment. Question 2. A client arrives with a gunshot wound to the abdomen and is bleeding heavily. Which assessment is the priority? A. Pain level. B. Blood pressure. C. Family history.
D. Allergie.
Correct answer. B. Blood pressure. Rationale: severe bleeding can quickly lead to hypovolemic shock. Blood pressure helps determine circulatory stability and the severity of blood loss. Strategy: in trauma situations, focus first on circulation and signs of shock. Life-threatening conditions always take priority. Question 3. A nurse is caring for a client who is choking and unable to speak. What is the nurse's first action? A. Offer water. B. Perform abdominal thrusts. C. Call the physician. D. Place the client in bed. Correct answer. B. Perform abdominal thrusts. Rationale: an inability to speak indicates a severe airway obstruction. Immediate abdominal thrusts may dislodge the object and restore airflow. Strategy: airway emergencies require immediate action. Do not delay treatment while seeking additional assistance.
Question 4.
A client with burns covering 40% of the body arrives in the emergency department. Which finding requires immediate intervention? A. Pain rating of 8 out of 10. B. Blister formation. C. Hoarseness and singed nasal hairs. D. Redness of the skin. Correct answer, C. Hoarseness and singed nasal hairs. Rationale: these findings suggest inhalation injury and possible airway obstruction. Airway compromise can become fatal if not addressed quickly. Strategy: always prioritize airway problems over other concerns. Airway obstruction can rapidly progress to respiratory failure. Question 5. A client is brought to the emergency department after a motor vehicle accident. Which assessment should be performed first? A. Assess pupil response. B. Assess pain level. C. Stabilize the cervical spine. D. Obtain the medication history. Correct answer, C. Stabilize the cervical spine. Rationale: trauma clients may have cervical spine injuries that can worsen with movement. Protecting the spine helps prevent permanent neurological damage. Strategy: follow trauma protocols and protect the cervical spine until injury is ruled out. Question 6. A client with suspected stroke arrives within 1 hour of symptom onset. What is the nurse's priority action? A. Give oral fluids. B. Obtain a blood glucose level. C. Encourage ambulation. D. Administer pain medication. Correct answer: B. Obtain a blood glucose level. Rationale: hypoglycemia can mimic stroke symptoms. Rapid glucose assessment helps determine the correct treatment pathway. Strategy: rule out reversible causes of neurological symptoms before proceeding with advanced interventions. Question 7. A client arrives with severe respiratory distress and oxygen saturation of 82%. What should the nurse do first? A. Obtain a complete history. B. Start oxygen therapy. C. Assess dietary habits.
D. Collect urine spécimen.
Correct answer: B. Start oxygen therapy. Rationale: an oxygen saturation of 82% indicates significant hypoxemia. Immediate oxygen administration helps improve tissue oxygenation. Strategy: treat breathing problems immediately. Oxygenation is essential for survival. Question 8. A client develops anaphylaxis after receiving medication. Which action is the priority? A. Administer epinephrine as prescribed. B. Check temperature. C. Obtain a weight measurement.
D. Encourage fuit.
Correct answer. A. Administer epinephrine as prescribed. Rationale. Epinephrine is the first-line treatment for anaphylaxis. It rapidly reverses airway swelling and improves circulation. Strategy. Recognize anaphylaxis as a life-threatening emergency requiring immediate medication administration.
Question 9.
A client with a head injury begins vomiting and becomes increasingly confused. What should the nurse do first? A. Notify the healthcare provider immediately. B. Offer clear liquids. C. Assist with ambulation. D. Reassure the family. Correct answer. A. Notify the healthcare provider immediately. Rationale. Worsening neurological status may indicate increased intracranial pressure. Immediate evaluation and treatment are necessary. Strategy. Changes in level of consciousness are emergency findings that require prompt action. Question 10. A client arrives with severe bleeding from a leg laceration. Which intervention should the nurse perform first? A. Apply direct pressure to the wound. B. Obtain laboratory specimens. C. Assess pain level. D. Start discharge teaching. Correct answer. A. Apply direct pressure to the wound. Rationale. Direct pressure is the fastest and most effective way to control external bleeding. Uncontrolled hemorrhage can lead to shock and death. Strategy. Stop active bleeding before performing additional assessments or interventions. Question 11. A client arrives with severe facial trauma after an accident. Which action is the priority? A. Assess pain level. B. Obtain consent for surgery. C. Ensure a patent airway. D. Start discharge planning. Correct answer. C. Ensure a patent airway. Rationale. Facial trauma can cause airway obstruction due to swelling, bleeding, or tissue damage. Maintaining airway patency is the highest priority. Strategy. Follow the ABCs. Airway issues must always be addressed before other interventions. Question 12. A client with suspected internal bleeding has cool, clammy skin and a rapid pulse. What should the nurse suspect? A. Hypertension. B. Hypovolemic shock. C. Hyperglycemia. D. Heart failure. Correct answer. B. Hypovolemic shock. Rationale. Internal bleeding can lead to significant fluid loss and shock. Cool skin and tachycardia are classic early signs. Strategy. Recognize shock symptoms early to prevent organ damage and deterioration. Question 13. A client arrives after a seizure. What is the nurse's priority assessment? A. Last meal eaten. B. Airway and breathing status.
C. Occupation.
D. Sleep pattern. Correct answer. B. Airway and breathing status. Rationale. After a seizure, airway obstruction and respiratory compromise may occur. Immediate assessment ensures adequate oxygenation. Strategy. Post-seizure care focuses first on airway protection and respiratory function. Question 14. A client presents with sudden shortness of breath, chest pain, and anxiety after surgery. Which condition should the nurse suspect? A. Pneumonia. B. Pulmonary embolism. C. Hypertension.
D. Gastritis.
Correct answer. B. Pulmonary embolism. Rationale. Sudden respiratory distress and chest pain after surgery are classic signs of a pulmonary embolism. This condition is potentially life-threatening. Strategy. Recognize postoperative complications that require immediate intervention. Question 15. A client involved in a house fire has soot around the mouth and nose. What is the priority nursing action? A. Provide oral fluids. B. Assess bowel sounds. C. Prepare for possible intubation. D. Measure height and weight. Correct answer. C. Prepare for possible intubation. Rationale. Soot around the airway suggests inhalation injury. Airway swelling can rapidly progress and obstruct breathing. Strategy. Anticipate airway compromise before symptoms become severe. Question 16. A client arrives with a blood pressure of 78/42 millimeter of mercury after severe diarrhea and vomiting. What is the priority intervention? A. Restrict fluids. B. Begin 4 fluid replacement. C. Encourage ambulation. D. Provide a high-protein meal. Correct answer. B. Begin fluid replacement. Rationale. Severe fluid loss can lead to hypovolemia and shock.
Rapide fluide remplacement, elle restaure circulation.
Strategy. Treat the underlying cause of unstable vital signs immediately. Question 17. A client with asthma is unable to complete a sentence without stopping to breathe. What should the nurse do first? A. Obtain a dietary history. B. Administer prescribed bronchodilator. C. Encourage deep breathing exercises. D. Weigh the client. Correct answer. B. Administer prescribed bronchodilator. Rationale. Difficulty speaking indicates severe respiratory distress. Bronchodilators can rapidly improve airflow. Strategy. Respiratory emergencies require immediate treatment to prevent respiratory failure.
Question 18.
A client presents with a possible spinal cord injury. Which action is most important? A. Encourage walking. B. Immobilize the spine. C. Check dietary habits. D. Obtain family history. Correct answer. B. Immobilize the spine. Rationale. Movement may worsen spinal cord damage. Immobilization protects the spinal column until evaluation is complete. Strategy. Prevent further injury while awaiting diagnostic testing. Question 19. A client with diabetes arrives confused and diaphoretic. What assessment should the nurse perform first? A. Blood glucose level.
Gelungsons.
C. Weight measurement. D. Visual acuity. Correct answer. A. Blood glucose level. Rationale. Confusion and diaphoresis may indicate hypoglycemia. Prompt testing helps guide immediate treatment. Strategy. Check for reversible causes of altered mental status first. Question 20. A client with severe allergic reaction develops stridor. What is the nurse's priority concern? A. Nutrition status. B. Airway obstruction. C. Sleep disturbance.
D. Fluide rétention.
Correct answer. B. Airway obstruction. Rationale. Stridor indicates narrowing of the upper airway. Immediate intervention is needed to prevent complete airway blockage. Strategy. Any sign of airway compromise requires rapid action. Question 21. A trauma client becomes restless and confused. What should the nurse suspect? A. Improved oxygenation. B. Early hypoxia. C. Adequate perfusion. D. Normal recovery. Correct answer. B. Early hypoxia. Rationale. Restlessness and confusion are often early signs of inadequate oxygen delivery. Prompt assessment is necessary. Strategy. Recognize subtle signs of respiratory deterioration before severe symptoms occur. Question 22. A client arrives with a tension pneumothorax. Which assessment finding is expected? A. Bilateral equal breath sounds. B. Severe respiratory distress. C. Bradycardia.
D. Hypertension.
Correct answer. B. Severe respiratory distress. Rationale. Tension pneumothorax causes lung collapse and impaired ventilation. Severe breathing difficulty is common. Strategy. Identify conditions that threaten breathing and circulation. Question 23. A client has a penetrating chest wound. What intervention should the nurse anticipate? A. Applying an occlusive dressing. B. Encouraging coughing exercises. C. Restricting oxygen therapy. D. Providing oral fluids. Correct answer. A. Applying an occlusive dressing. Rationale. An occlusive dressing helps prevent air from entering the chest cavity. This reduces worsening of the injury. Strategy. Understand emergency interventions for chest trauma. Question 24. A client with suspected meningitis arrives in the emergency department. Which symptom requires immediate attention? A. Fever. B. Headache. C. Decreased level of consciousness.
D. Neck stiffness.
Correct answer. C. Decreased level of consciousness. Rationale. Altered consciousness may indicate worsening neurological status. This requires immediate evaluation. Strategy. Prioritize findings that threaten life or neurological function. Question 25. A client arrives after a drowning incident. What is the priority nursing action? A. Assess oxygenation status. B. Ask about swimming ability. C. Obtain dietary history. D. Assess vaccination status. Correct answer. A. Assess oxygenation status. Rationale. Drowning can lead to severe hypoxia and respiratory failure. Oxygenation must be evaluated immediately. Strategy. Focus on breathing and oxygen delivery in water-related emergencies. Question 26. A client with severe burns becomes increasingly restless. What should the nurse suspect? A. Improved comfort. B. Adequate hydration. C. Hypoxia. D. Pain relief. Correct answer. C. Hypoxia. Rationale. Restlessness is often an early sign of oxygen deprivation. Burn clients are at risk for inhalation injuries. Strategy. Monitor for subtle changes that may indicate worsening respiratory status. Question 27. A client arrives with sudden unilateral weakness and slurred speech. What should the nurse suspect? A. Stroke. B. Migraine. C. Gastritis.
D. Appendicity.
Correct answer. A. Stroke. Rationale. Sudden neurological deficits are hallmark signs of a stroke. Rapid treatment improves outcomes. Strategy. Recognize stroke symptoms quickly and activate emergency protocols. Question 28. A client with a fractured femur suddenly develops shortness of breath and confusion. Which complication should the nurse suspect? A. Fat embolism syndrome. B. Kidney stones. C. Appendicitis.
D. Hypertension.
Correct answer. A. Fat embolism syndrome. Rationale. Long bone fractures can release fat droplets into circulation. Respiratory distress and neurological symptoms are common signs. Strategy. Know the life-threatening complications associated with orthopedic injuries. Question 29. A client arrives with severe dehydration and weak pulses. What should the nurse assess first? A. Circulatory status. B. Family support system. C. Learning needs.
D. Sleep habit.
Correct answer. A. Circulatory status. Rationale. Dehydration can impair tissue perfusion and lead to shock. Circulation assessment helps determine severity. Strategy. Prioritize circulation when signs of volume loss are present. Question 30. A client develops ventricular fibrillation on the cardiac monitor. What should the nurse do first? A. Check blood glucose. B. Begin discharge teaching. C. Defibrillate according to protocol. D. Obtain a health history. Correct answer. C. Defibrillate according to protocol. Rationale. Ventricular fibrillation is a lethal cardiac rhythm that requires immediate defibrillation. Delays greatly reduce survival chances. Strategy. Recognize emergency cardiac rhythms and initiate life-saving interventions without delay. Question 31. A client arrives at the emergency department with severe abdominal pain and a rigid abdomen. What should the nurse suspect? A. Indigestion. B. Peritonitis. C. Constipation.
D. Heartburn.
Correct answer. B. Peritonitis. Rationale. A rigid, board-like abdomen is a classic sign of peritoneal irritation. Peritonitis can rapidly become life-threatening if untreated. Strategy. Recognize signs of acute abdominal emergencies that require immediate evaluation. Question 32. A client with chest trauma develops tracheal deviation. What complication should the nurse suspect? A. Asthma attack. B. Tension pneumothorax. C. Bronchitis.
D. Pneumonia.
Correct answer. B. Tension pneumothorax. Rationale. Tracheal deviation is a late sign of tension pneumothorax. Immediate intervention is required to prevent cardiovascular collapse. Strategy. Learn the hallmark signs of life-threatening chest injuries. Question 33. A client with severe blood loss has a urine output of 15 milliliters per hour. What does this finding indicate? A. Adequate kidney perfusion. B. Fluid overload. C. Poor tissue perfusion. D. Normal renal function. Correct answer. C. Poor tissue perfusion. Rationale. Low urine output is an early sign that organs are not receiving adequate blood flow. It often occurs during shock. Strategy: monitor urine output closely as an indicator of circulatory status. Question 34. A client arrives with a suspected opioid overdose. Which assessment finding is expected? A. Dilated pupils.
G. Rapid respirations.
C. Pinpoint pupils.
D. Hypertension.
Correct answer: C. Pinpoint pupils. Rationale: opioid overdose commonly causes respiratory depression and pinpoint pupils. These are key assessment findings. Strategy: identify characteristic signs associated with common drug overdoses. Question 35. A client with severe respiratory distress suddenly becomes drowsy. What is the nurse's priority action? A. Continue observation. B. Notify family members. C. Assess airway and oxygenation immediately. D. Offer oral fluids. Correct answer: C. Assess airway and oxygenation immediately. Rationale: drowsiness may indicate worsening hypoxia and impending respiratory failure. Immediate assessment is necessary. Strategy: changes in mental status often signal deteriorating oxygenation. Question 36. A client experiences electrical burns. What is the priority assessment? A. Skin color only. B. Cardiac rhythm. C. Hair condition.
D. Aptite.
Correct answer: B. Cardiac rhythm. Rationale: electrical injuries can cause serious cardiac dysrhythmias even when external burns appear minor. Continuous monitoring is essential. Strategy: assess for hidden internal injuries associated with electrical trauma. Question 37. A client with a head injury has unequal pupils. What should the nurse do first? A. Document the finding and reassess later. B. Notify the healthcare provider immediately. C. Encourage rest. D. Provide food and fluids. Correct answer: B. Notify the healthcare provider immediately. Rationale: unequal pupils may indicate increased intracranial pressure or neurological deterioration. Immediate medical evaluation is required. Strategy: treat changes in neurological status as urgent findings. Question 38. A client arrives with severe heat stroke. Which assessment finding is expected? A. Cool, moist skin.
B. Hot, dry skin.
C. Bradycardia.
D. Hypothermia.
Correct answer: B. Hot, dry skin. Rationale: heat stroke is characterized by failure of the body's temperature regulation system, resulting in hot, dry skin and hyperthermia. Strategy: differentiate heat stroke from other heat-related illnesses. Question 39. A client with suspected sepsis has a blood pressure of 84/50 mmHg. What is the priority nursing action? A. Administer prescribed 4 fluids.
B. Increase oral intake.
C. Restrict activity only. D. Delay treatment until lab results return. Correct answer: A. Administer prescribed 4 fluids. Rationale: hypotension is a sign of septic shock and requires rapid fluid resuscitation. Early intervention improves survival. Strategy: treat unstable vital signs promptly while continuing assessment.
Question 40.
A client arrives after ingesting an unknown poison. What is the nurse's first action? A. Determine what substance was ingested. B. Encourage vomiting. C. Give milk immediately. D. Provide a meal. Correct answer: A. Determine what substance was ingested. Rationale: identifying the poison helps guide appropriate treatment. Some substances become more harmful if vomiting is induced. Strategy: gather critical information before implementing treatment measures. Question 41. A client with severe asthma suddenly develops silent lung sounds. What should the nurse recognize? A. Improvement in condition. B. Respiratory failure is imminent. C. Anxiety reduction. D. Normal response to treatment. Correct answer: B. Respiratory failure is imminent. Rationale: silent chest sounds indicate little or no air movement. This is a medical emergency requiring immediate intervention. Strategy: Recognize worsening respiratory distress even when wheezing disappears. Question 42. A client develops chest pain and shortness of breath during a blood transfusion. What is the nurse's first action? A. Slow the transfusion rate. B. Stop the transfusion immediately. C. Obtain a meal tray. D. Reposition the client and continue. Correct answer. B. Stop the transfusion immediately. Rationale. These symptoms may indicate a transfusion reaction. Stopping the transfusion prevents further complications. Strategy. Follow transfusion reaction protocols without delay. Question 43. A trauma client becomes hypotensive and tachycardic. What should the nurse suspect? A. Internal bleeding. B. Recovery from injury.
C. Approuvé de circulation. D. Adéquate hydration.
Correct answer. A. Internal bleeding. Rationale. Hypotension and tachycardia are common signs of hemorrhagic shock. Rapid assessment and intervention are needed. Strategy. Look for signs of hidden blood loss in trauma patients. Question 44. A client with diabetic ketoacidosis arrives with deep, rapid respirations. These respirations are known as A. Cheyne-Stokes respirations. B. Kussmaul respirations. C. Byatt respirations.
D. Apnostic respiration.
Correct answer. B. Kussmaul respirations. Rationale. Kussmaul respirations occur as the body attempts to compensate for metabolic acidosis by eliminating carbon dioxide. Strategy. Associate respiratory patterns with underlying conditions. Question 45. A client with a severe allergic reaction becomes hypotensive. Which medication should the nurse anticipate administering first? A. Acetaminophen. B. Epinephrine. C. Furosemide.
D. Insulin.
Correct answer. B. Epinephrine. Rationale. Epinephrine is the first-line treatment for anaphylactic shock. It improves blood pressure and reduces airway swelling. Strategy. No emergency medications for life-threatening allergic reactions. Question 46. A client with carbon monoxide poisoning arrives in the emergency department. Which treatment is a priority? A. Oxygen therapy.
B. Oral hydration.
C. Antibiotics. D. Bed rest only. Correct answer. A. Oxygen therapy. Rationale. Carbon monoxide reduces the blood's ability to carry oxygen. High-flow oxygen helps displace carbon monoxide from hemoglobin. Strategy. Focus on restoring oxygen delivery to tissues. Question 47. A client develops sudden severe headache, nausea, and decreased consciousness. What should the nurse suspect? A. Subarachnoid hemorrhage. B. Gastritis. C. Sinus infection.
D. Migraine improvement.
Correct answer. A. Subarachnoid hemorrhage. Rationale. A sudden, severe headache with neurological changes is a classic presentation of subarachnoid hemorrhage. Strategy. Treat abrupt neurological symptoms as emergencies. Question 48. A client arrives with signs of shock. Which finding indicates worsening shock? A. Increased urine output. B. Warm extremities and alertness. C. Decreasing blood pressure and confusion. D. Stable heart rate. Correct answer. C. Decreasing blood pressure and confusion. Rationale. Falling blood pressure and altered mental status indicate worsening tissue perfusion. Immediate intervention is required. Strategy. Monitor trends rather than isolated vital signs.
Question 49.
A client with multiple fractures suddenly complains of chest pain and difficulty breathing. What complication should the nurse suspect? A. Fat embolism syndrome. B. Constipation. C. Appendicitis. D. Peptic ulcer disease. Correct answer. A. Fat embolism syndrome. Rationale. Fat emboli can occur after long bone fractures and often present with respiratory distress and chest symptoms. Strategy. Recognize orthopedic complications that affect the lungs. Question 50. A client is brought to the emergency department unresponsive and pulseless. What is the nurse's priority action? A. Obtain a complete medical history. B. Begin CPR immediately. C. Assess pain level. D. Obtain consent forms. Correct answer. B. Begin CPR immediately. Rationale. An unresponsive, pulseless client is in cardiac arrest. Immediate CPR helps maintain circulation until advanced interventions are available. Strategy. In cardiac arrest situations, start high-quality CPR without delay to maximize survival chances.